Hi, my name is Kelly Gunn. I am a DNP student at the College of Nursing. The title of my project is The Effects of Nurse-Led Telephone Counseling on Self-Efficacy in Adults with Type 2 Diabetes. Diabetes is increasing in prevalence, it impacts populations worldwide, and new diabetes diagnosis rates remain steady despite implementation of state and national self-management and prevention programs. Long-term complications from diabetes include problems with the eyes, kidneys, nerves, your circulation, your heart, and possibly stroke. Extensive self-care outside the office setting creates a need to address clinical, emotional, and lifestyle strategies to avoid these diabetes-related complications. Self-efficacy is believing in one's ability to succeed or accomplish a goal and is the cornerstone of behavior change. The purpose of this project was to determine whether biweekly telephone counseling, providing education and support from a nurse, improves self-efficacy for patients with diabetes. This was a pilot project. The initial sample size was 8, with 4 participants completing it in its entirety. It took place at the Greater New Bedford Community Health Center and used a semi-structured, open-ended, and evidence-based guide to direct telephone interventions. These interventions took place every 1 to 2 weeks and addressed attitudes and barriers towards diabetes. The Diabetes Empowerment Scale short form was the tool used to evaluate pre- and post-intervention diabetes-related self-efficacy. These results were compared and analyzed using the Wilcoxon-Stein rank test. Demographic data was also analyzed for intercorrelation, and content analysis was done on qualitative and satisfaction survey data. There were 2 theoretical models that guided this project. The first was the Johns Hopkins evidence-based practice model, and the second was the health belief model. Results showed a notable disconnect between perceived self-efficacy and actual diabetes control. Individualized interventions have a clinical impact on diabetes self-care and knowledge attainment. There was a numeric increase in self-efficacy in the expected direction, which lends to clinical significance despite not having statistical significance. Diabetes education programs should continue to target minority populations, and qualitative data shows an overarching theme of powerlessness and fatalism. Clinical recommendations include clinician awareness of how to support and educate patients to help achieve long-term diabetes outcomes. Future projects duplicating the design with a larger sample and a longer intervention duration are needed. They could also expand the project to another clinic setting or other chronic diseases. They could expand recruitment to target specific glucose levels, and clinics could consider a different modality using secured messages, text messages, or web-based coaching interventions in the future. Thank you.